The spinal cord injury. So when we say spinal cord injury, it is a damage to any part of the spinal cord or nerves at the end of the spinal canal, or what we call the cauda equina. So often causes permanent changes in state, in strength, sensation, and other body functions below the site of the injury. So what are the etiology or the causes of the spinal cord injury? Of course, we have what we call the trauma brought by the motor or vehicular accident. Another thing is the fall, penetrating trauma like stabbing or gunshot wound, and the sports, and of course recreation injuries. So include na natin yung mga sports like diving, car racing, motor racing. So isa yan sa mga sports wherein we can acquire this kind of injury. And what else about the alcohol? So matik yan, if you'll be using alcohol prior to driving, there's a tendency that you will be meeting an accident along the way. Then another thing is of course the diseases like the cancer, arthritis, osteoporosis, and of course inflammation of the spinal cord. So if you will notice, if the diseases that the patient is having is focusing on the bones, somatic, there would be an imbalance with regards to the movement of the patient. So there's a possibility that that will lead to fall because there would be an imbalanced movement. So these are the visual representation of the causes of the spinal cord injury. The motor, and of course the trauma, the stab wound, and the fall, and even alcoholism. Then, what are the risk factors? So being male is one of the risk factors. Bakit kaya? Kasi most of the male individual kasi sila yung hiling mag-explore, okay? So they really want to try anything. Especially kapag halimbawa na they have taken this kind of alcohol or some drugs, pakiramdam nila sa sarili nila sila yung pinakahari ng mundo. So yun yung mga risk factors kung bakit there are certain injuries or accidents na po pwede nilang makuha because of this attitude. And another thing is being between the ages of 16 and 30. So yan yung mga tinatawag natin kapag ginusto nila yung mga age na ganyan. So in between those ages 16 and 30, if they really want to do something, they will just insist on it. Kasi the more na piniprevent mo silang gawin yun, lalo silang nagpupumilit na gawin yung isang bagay. So these are the age bracket actually of or the risk factors of acquiring this kind of disease, this kind of injury. And being older than 65. So, ano namang reason kaya? So, knowing that the elder patients, medyo mahihina na ang buto niyan eh. So, most of the time, they were prone to fall. Then, engaging in risky behavior like diving and motor vehicle. So, yan, yung most of the time. Sabi ko nga kanina, they really want to try something new. So, yung diving sa iba, karamihan talaga, ibang bagay yon. So, magandang experience kumbaga. So, they will try on doing those kind of sports or activity. Then, having a bone or joint disorder. So, isa rin yun sa mga risk factor of acquiring spinal injury. So, what are the complications? Of course, one of which is, of course, the bladder control. Your bladder will continue to store urine from your kidneys. However, your brain may not be able to control your bladder as well because the message carrier, which is the spinal cord, has been injured. So, yun yung problem. So, kapag talaga affected na yung spinal cord natin, of course, there would no more be an element who will control, okay? Who will dictate of what needs to be done. And another thing is when we say there is a complication as well with the bladder, there will also be a complication with regard to his bowel. So, halos magkarugtong yan, okay? Joint forces, kumbaga, ang bladder and of course the bladder control. So, although your stomach and intestines work much like they did before your injury, control of your bowel movement is also altered. Then, there is also skin sensation. So, below the neurological level of your injury, you may have lost part or all of your skin sensations. So, So therefore, your skin can't send a message to your brain when it's injured by certain things such as prolonged pressure, heat, or cold. Kasi nga, affected na yung magta-transmit ng messages. Okay? Then, another thing is the circulatory control. A spinal cord injury may cause circulatory problems ranging from low blood pressure when you rise, or what we call the orthostatic hypotension, up to swelling of your extremities. If the problem would be this one, the circulatory matic, there would be edematous on certain parts of the body, especially the upper and lower extremities, because the circulation changes may also increase your risk of developing blood clots such as DVT and of course the pulmonary embolus. Okay, what else? Aside from this one, you'll be also developing bedsore as you will stay for long in the hospital, and possible also that the patient might acquire pneumonia if the patient will stay there in the bed for a long period of time. Then respiratory system, your injury may make it more difficult to breathe and cough if your abdominal and chest muscles are also affected. And this include the diaphragm and the muscles in your chest wall and of course the abdomen. Okay. Then what else? Even the muscle tone. Some people with spinal cord injuries experience one of the two types of muscle tone problems. So what are those? The uncontrolled tightening or motion in the muscle, or which we call the spasticity, and the soft and limp muscles lacking muscle tone, which we call the flaccidity. So there are two types of muscle tone, the flaccidity and the spasticity. Then the fitness and the wellness. Weight loss and muscle atrophy are common soon after a spinal cord injury. So limited mobility may lead to a more sedentary lifestyle because you will be staying for a long period of time in the bed. So placing you at risk for what? Obesity, diabetes, and even the cardiovascular disease. So as nurses, part of our job, if we have this kind of patient suffering from this kind of injury, we need to assist the patient in doing some bedside exercises. Okay? So sabi nga nila, the patient might lead to a sedentary lifestyle. So, hindi niya kasi may galaw eh. So, as nurses, tutulungan natin sila para kahit papaano maiwasan yung mga certain complications or diseases na po pwedeng ma-acquire ng pasyente. So, we need to exercise our legs, even the arms, para kahit papaano. Pero syempre, we need to be more careful kasi nga the patient is suffering from the spinal cord injury. Then, what else? The sexual health, sexuality, fertility, and the sexual function may be affected by spinal cord injury. So, for men, they may notice some changes in the erection and, of course, the ejaculation. And for women naman, they may notice changes in their lubrication. So, and there is also pain. So, some people experience pain such as muscle or joint pain from overuse of particular muscle groups. So, kasi we have two types of spinal cord injury. We have the incomplete and we have the complete spinal injury. So when we say incomplete, there are certain body parts that we can still move. Okay? Unlike dun sa complete injury, matic that he cannot move on his own. He will just stay in the bedside for a long period of time. So in that case, mas ma-pressure yung mga isa incomplete spinal injury, mas ma-pressure yung mga parts na pwede niyang gamitin ng madalas. Okay, so there would those parts will develop pain. And for those complications that we have mentioned, that those things will lead to what we call depression. So the patient coping with all these changes a spinal cord injury brings and living with pain causes some people to experience depression. So as nurses, for them not to experience this kind, so ano ba dapat gawin ng mga nurses? So kaya nga makikita niyo yung ibang mga nurses kinikwentuhan yung mga pasyente nila. Kasi kahit naman siguro kayo, kung halimbawa you stay there for a very much long period of time on your bed, talaga namang madidepress ka. So, much better if the nurses, kapag pumapasok sa besa room ng pasyente, kahit paano, kinakausap natin yung ating mga patient. We need to talk to them. Okay? We need to encourage them. Kapag sa tingin nyo is medyo nawawala na siya sa, tawag natin, nawawala na siya ng gana, something like that. Might as well kausapin, talk to them, establish rapport, be friend with them, kahit pa paano makakabawas yun to alleviate their suffering from depression brought by the spinal cord injury. So what would be the prevention for the spinal cord injury to happen? So drive safely, wear a seat belt every time you will drive or ride in a car. Check water depth before diving. So to make sure you don't dive into shallow water, don't dive into a pool unless it's 12 feet or deeper. Don't dive into an above ground pool, and don't dive into any water of which you don't know the depth. Okay? Then prevent falls. Use a step stool with a grab bar to reach object in high places and handrails along stairways, and put non-slip mats on the tile floors and in the tub or shower. And for young children, use safety gates to block stairs and consider installing window guards. So in the hospital setup naman, the first thing that we need to be reminded of is, of course, we need to maintain the side rails of the bed every now and then. Okay, maintain the side rails up at all times. Then give instruction to the relatives to prevent this kind of injury. Then take precautions when playing sports. Always wear recommended safety gear, and don't drink and drive. So don't drive while intoxicated or under the influence of drugs, and don't ride with a driver who has been drinking. So in that type of injury, the spinal cord injury, there are two possible injury or diseases, or let's say for example an incident that the patient might acquire during her hospitalization, and one of which of course is the fall. Okay, so to prevent fall, maintain side rails up at all times, educate relatives regarding fall prevention, and monitor patients as often as possible. Much better if you will assign the patient near the station of the nurse's station, so that you can see that, so that the nurses can see every now and then the condition of the patient. So what else? In some, there are certain steps to help reduce the falls. Of course, you need to ensure bedside tables and belongings are within the patient's reach. If she can still move his body, half of his body, especially the hands, and she needs to call his employees or his colleagues, so might as well tell the relatives to put everything on the bedside. Okay, especially the cell phone or the eyeglasses of the patient. Then ensure walking aids are within the patient's reach if the patient needs the walker. And of course, ensure glasses are clean and hearing aids are working also. And ensure nurse call is within patient's reach. So this one is the first one actually that you need to instruct the relatives and as well as the patient. Once the patient is admitted in the room, you need to orient the patients or the relatives as well on how to use the nurse call. Okay, then another thing is ensure good fitting footwear and anti-slip socks to prevent fall. Now moving on to the another injury that the patient might acquire during his stay in the hospital while having this kind of spinal cord injury. So another type is, of course, is the bedsore or the pressure ulcer. This is also called pressure ulcers and decubitus ulcers. These are injuries to skin and underlying tissue resulting from prolonged pressure on the skin. So bed sores most often develop on the skin that covers bony areas of the body, such as the heels, ankles, hips, and the tailbone. So we have different stages of bed sore. As you can see from this PowerPoint presentation, for the stage 1, The intact skin with non-blanchable redness of the localized area, usually over a bony. Darkly pigmented skin may not have invisible blanching. Its color may differ from the surrounding area. So, in layman's term, actually, when we say stage 1, as nurses, when the patient came into the patient's to the room, as nurses, we need to do the physical assessment. So, we need to check the body parts of the patient, check for any presence of ulcer. So if there would be something like this one, when you touch the area that is, when you press the area, there is pain and there is also tenderness, and also the temperature is a little bit warm. That one is considered stage 1. Now what about the stage 2? Partial thickness, loss of dermis, presenting as a shallow open ulcer with a red-pink wound bed without slough, may also present as an intact or open ruptured serum-filled blister. So from the stage 1, you have found out that there is area wherein there is a slight redness, and of course there's a positive for tenderness as well. So for the stage 2, aside from those things that you've found out for the stage 1, you will also notice the blister formation. And if that one, the blister formation has already been removed, the blister has already been removed, that one is what we consider the stage 2. So from the stage 1, there is a redness and pain. From the stage 2, aside from the pain and redness, there is also blister formation. Or if the blister has been removed, that one is considered the stage 2. Now what about this stage 3? There is a full thickness tissue loss. Subcutaneous fat may be visible, but bone, tendon, or muscles are not exposed. So stage 3, there would be no exposure of the bone, tendon, and muscles, but still there is redness. But this one is a little bit what did you call this? Mas grabe siya doon sa stage 2. Okay, so this one from the stage 2, there is blister formation, and the blister has been removed. And this one, the stage 3, everything has been removed. There are tissue. You'll be seeing tissue, reddened tissue here. Okay, but then you haven't seen the tendons or the bones. Okay, so this one is the stage 3. Okay, okay, and what else? There is a slough, maybe may be present, but does not obscure the depth of tissue loss. May include undermining and tunneling. So for the stage 4, there is full thickness tissue loss with exposed tendon or muscle. Slough or a scar may be present on some parts of the wound bed. Okay, as you can see from the picture, there is a yellowish formation. Sometimes there's a pus, and there is also bad odor from the side, and there is also a tunneling or undermining. So that one is what we consider the stage 4. Then for the suspected deep tissue injury, purple or maroon localized area of discolored intact skin, or blood-filled blister due to damage of underlying soft from pressure and or shear. The area may be preceded tissue that is painful, firm, ashy, boggy, warmer or cooler as compared to the adjacent tissue. And there is what we call also the unstageable. Okay, so there is in this unstageable, there is full thickness tissue loss in which the base or the ulcer is covered by yellow, tan, gray, green, or brown, and or scar. Okay, in the wound bed. But as you can see, we'll just focus on the stage 1 and up to the stage 4. If you think that what you've observed from the wound of the patient is not being visible in this stage 1 to stage 4, you can also ask your seniors, or might as well ask the help of the resident surgeon to assist you on how to properly grade the bedsore of the patient. But as nurses, we should know on how to differentiate the bedsore from stage 1 to stage 4. So what are the symptoms of bedsore? Of course, there are warning signs of bedsores or pressure ulcers. The following are unusual changes in the skull or texture. There is swelling, pus-like draining, an area of skin that feels cooler or warmer to the touch than other areas, and of course there is also tenderness. And what are the common sites of pressure ulcers? For people who use wheelchairs, bed sores are often occur on the tailbone or buttocks, shoulder blades and spine, backs of arms and legs where they rest against the chair. And for the bedridden patient, of course, you might see the pressure ulcer on the back or sides of the head, the shoulder blades, the hips, the lower back or the tailbone, and the heels, ankles, and skin behind the knees. Even the tip of the ears can also be a site for pressure ulcer. So what are the prevention? So tips for repositioning, so shift weight frequently or reposition the patient every 2 hours. Lift patient if possible. If you have enough upper body strength, she can do the wheelchair push-ups, raising your body off the seat by pushing on the arms of the chair. And look into specialty wheelchairs. Some wheelchairs allow you to lift them, which can relieve pressure. And what else? If the patient is bedridden, as nurses, we can assist the patient and to do some bedside exercises. Simple raising of the arms and the legs will help in preventing the acquiring of this bed sore. Okay, then select cushions or mattress that relieve pressure. Use cushions or special mattress to relieve pressure and help ensure that your body is well positioned. Do not use donut cushions as they can focus pressure on surrounding tissue. In most of the hospital, we're using the egg crate mattress. So, from the term egg crate, as you can see, yung tray mismo ng egg. Okay, so ganun-ganun ang itsura ng egg crate mattress. So if the patient is very much prone to develop ulcers, specifically if the patient is bedridden and she's very thin, makita mo na talaga na yung kanyang bones masyado nang revealing, kumbaga. So that's the best time that you can ask for the relatives to buy this kind of mattress, which we call the egg crate mattress. Then adjust the elevation of your bed. If the patient's bed can be elevated at the head, raise it no more than 30 degrees. This will help prevent also shearing. Now what about the tips for skin care? So keep skin clean and dry. Wash the skin with a gentle cleanser and pat dry. Do this cleansing routine regularly to limit the skin's exposure to moisture, urine, and stool. So always be reminded to maintain your patients dry. Okay, if the patient is wearing diaper, always check for the diaper. If she's been wet with the urine and the stool, change the diaper. Okay, then protect the skin. Use moisture barrier creams to protect the skin from urine and stool. Then change the bedding and clothing frequently if needed, and watch for buttons on the clothing and wrinkles in the bedding that irritate the skin. Okay, then inspect the skin daily. Look closely at the skin daily for warning signs of a pressure sore. So again, let me remind you nurses that when the patient came into the hospital, it's our responsibility to check for the patient's safety and check also for the bed sore if there is. If the patient has been admitted to you without bed sore and she acquired the bed sore in the hospital, you need to explain it further. How come that the patient is having this kind of bed sore? Because the meaning of this thing that the patient is having a bed sore for a short period of means you have given poor nursing care to the patient. Okay, so you need to do the check for the patients every now and then do the turning. Okay, then maintain dryness of the patient. Inspect the skin daily. Okay, then look closely at the skin daily for warning signs of pressure sore. Okay, so this is the procedure wherein we will be doing the caring for pressure ulcers. So I'll be showing you the sample video presentation of this one, but I will be discussing first the procedure. So first thing and foremost, we need to do hand washing. Then ensure the patient's privacy, because there are some bed sores that is located on the specific parts wherein that area needs to be covered. Okay, so we need to ensure privacy. And another thing is self-introduction. Identify a patient using identifiers. Again, check for the ID bands. Then while checking for the ID bands, you may now ask the patient's name and of course the patient's birthday. Then position patient in a comfortable position. So if the patient will be, if the affected side is on the right side, make sure to raise the side rails of the left side so that once you expose the affected side, which is on the right, the patient can hold the side rails on the left side. Then place drape and expose the affected area. Apply now the clean gloves. Then open the topical solution and keep the dressing sterile. Then you need to remove the old dressing and take note the amount and color of the drainage. So once you remove, the old dressing, don't just throw that away. Okay? Don't immediately throw that away. You need to check for the dressing. Check how soaked it is, what kind of drainage you have collected from the patient. And if there is a foul odor, you need also to document that one. Then you need to evaluate the ulcer. Of course, you need to check for the stage, the wound characteristics, and even the temperature, and of course the measurement of the depth. Then place under pads under the affected area. So if you will be about to clean the wound, you need to place the under pads and of course the kidney basin. And that's the time you can clean the affected site with the saline solution or any prescribed solution with the use of the aseptic syringe. So in some other hospital, they are using the Dakin solutions. This one is suggested or ordered by the doctor. So if there would be an order like the Dakin solution, so you can use that one instead of the saline solution. Then you can use of course the aseptic syringe or the 50cc syringe in flushing the open one. Then dry and put some ointment in the cotton tip applicator to cover the ulcer. So after rinsing it with the saline solution or the Dakin solution, pat it dry. And after patting it dry, put an ointment on the cotton tip applicator, then place it on the wound. And or you may also use the gauze, put an ointment there. Most of the time they're using this calmoseptin ointment. Then they will place it on the affected site. Then they will cover it with a secondary dressing such as the dry gauze or transparent one to completely cover the ulcer. Then you need to remove gloves and reposition the patient comfortably. Then do the aftercare and do the hand washing. So I will be showing you the sample video presentation of this doing the aftercare, doing the care for the patients having this kind of bedsore. So if there will be no questions anymore with regards to this discussion, so thank you very much for your time. Then hope to submit your return demonstration on April 29. Okay, for this caring of the patients with bedsore. So thank you very much and God bless.